Hey everybody, this is Travis, and it is Ask a PT. I'm here again with Todd, our clinical director in our Easton office, and we got a question, kind of a comment, but a point being made, and we'll kind of make a question out of it. Joan says she wants to address the fact that PT can help you avoid surgery. She's been doing PT for her knee, and the exercises that she's been doing help her avoid surgery, and everybody in Upper Country is awesome. So the question kind of is if maybe I've been told I need surgery or I've been told surgery might be the fix for whatever problem I have. Can physical therapy help you avoid the need for a surgery?
Yeah, so this is a common thing that comes up. And if you really kind of think of if I were to classify like kind of like all orthopedic surgeries, they're all elective surgeries. You don't need it to save your life. So there does become some decision making. When patients ask about that, like, hey, can I avoid surgery? I would like to do that. Surgery should be kind of like a last option. Like I've tried other conservative stuff first, but then surgery is something that's definitely more serious. I always tell my patients, there's no such thing as routine surgery. So you should take all of them seriously. Um, but I always talk to him about a famous football player from the 1900s when Travis and I were younger. Yeah, oh, is that him up there? Thurman Thomas. All right. We learned about this in PT school. This is a big. He's kind of like a case study for us. But he was playing football at Oklahoma State and he tore his ACL, which is almost always a surgical procedure, particularly for a high level athlete. I didn't talk to Thurman. I don't know the whole story. I'm suspecting someone else might have been taking his job. So he elected to not have the surgery, and the rumor is he never had it replaced throughout his NFL career. So he played a very long NFL career with very large men tackling him. Had no ACL, but wow, were his legs strong. You Google a picture of him, you can see his quads from 100 yards away. So he just created such stability and strength in his knee that his ACL was not necessary for an NFL career. That's an extreme case, right? But I have many patients come in that are, have a rotator cuff injury. Right? Like, oh, my shoulder's bothering me. Hey, maybe there's a partial tear. All the way up to I have a full thickness tear of one of the muscles in my rotator cuff. There's four muscles in your rotator cuff, right? So you got some helpers in there, but I have had many patients like elect to not have that surgery and rehab a completely torn one muscle in the rotator cuff. And they can get full motion like overhead, and do well. What I ask the patient is like, what are your goals? Like, are you going to be trying out for the New York Yankees and need to throw a ball really hard? And like, nope, no need to do that. Like, but I need to get my hands up overhead and lift things. That is feasible depending on the damage to, whatever we're talking about. If we're talking about a shoulder, knee, or foot. Yeah, we're going to try and do everything conservatively to, build strength and stability around a joint. That's usually what a repair is kind of going in and doing, like repairing a muscle or repairing maybe like a ligament or providing stability in that joint. If I can get my muscles to do it and avoid surgery, yeah, absolutely, you can do it. And we've done it many, many times in our clinic.
Yeah, I think another common thing that we see in our clinic is I went in, I got an X-ray for my knee. They say I have no cartilage, it's bone on bone, so I need to get a knee replacement. So when patients come in and say that, and they're coming to PT, and a lot of times it comes during the course of PT, they go get an ortho appointment, and the doctor says, "Yeah, we got to do a knee replacement." What would you say to someone that has been told they have little or no cartilage left in their knee, and they should get a knee replacement?
Yeah, so we hear that a ton, obviously, and people always they just really certain words stick in patients' brains. Say, "Oh yeah, my knee is bone on bone." All right, your knee bones have been touching each other since you were born, so like the bones are always touching. What they're saying is there isn't as much kind of cushioning between those two. Um, but like it wears out over time. Similar, we talked about like with like a car. If I use my car, the tires will wear on it, so I can have some pain and dysfunction there. But and that would be we would consider under the category of arthritic changes of that knee. The best thing for arthritic joints is movement, right? Exercise, stretching, physical therapy, right? So, a lot of patients can get good benefit from coming in for physical therapy and, kind of like avoiding that knee surgery. I think a lot of times we are trying the best we can to keep people out of the operating room unless it's absolutely necessary. Many times it is. But yeah, with the knees, that's one that's like super common. And I'll share just one story that always sticks with me. I have patients come in and like, yeah, I have a knee replacement, and so they had that done. And I've had several times say, yeah, and my doctor says I'm gonna need that other one replaced. And I'm like, okay, that's interesting. Like, so do you have? I mean, do you have pain? Is there any problems with it? Like, oh no, I don't have any problems with it. And I'm like, well, how do we know we need to replace? I would be doing everything I can to make sure I don't get that replaced and do stretching and exercise to kind of work on it. So, surgical recommendations are always like a recommendation from a doctor. I think it's always good to explore other options, like physical therapy. So yeah, I think those are good ways to kind of think about it. But the best way to do that, we have to evaluate you, right? So sometimes you need surgery, but yeah, sometimes you don't. So you have to talk to a good physical therapist to guide you with that.
Yeah, before we get crushed in the comments, we send people out for surgeries. So it's not like we're saying never get surgery. But what Todd said is right. There's no such thing as a routine surgery. So I have a patient right now that he's going to need shoulder surgery. I'd be really surprised. We sent him for ortho. I'd be surprised if he doesn't come back with a shoulder reconstruction. So that happens, but we definitely want to avoid that as much as they can. Conservative care like physical therapy, massage therapy, chiropractic care, acupuncture, anything that can, diet and lifestyle management can help out with inflammatory responses for sure. Just because you have diagnostic testing that might indicate that you need a surgery doesn't mean that that diagnostic testing is the end all be all. And any good surgeon will tell you that, especially for shoulders. Like I, the one shoulder surgery I observed when I was in school, I remember the surgeon was in the operating room, puts up the MRIs. He goes, "All right, this is when you used to put screens up on the MRIs." And say, "This is I see this in here." He says, "I don't know what's going on in there. I won't know until I get in there." And thought he was going to do an orthoscopic, and he's like, "I can't see what's going on." He had to open shoulder all the way up, and sure enough, what he saw on the MRI did not match what was actually in the patient's shoulder. So we're not saying all surgeries are bad. We send out for surgeries, not routinely, but we do have to do it. You just want to, if there's a way to avoid those, it's probably a good idea.
Yeah, and what I always tell patients, some patients, well, hey, if I need surgery, should I come to PT? Like, if I'm eventually going to need surgery, any strengthening range of motion improvements that you do before surgery is going to help your outcome afterwards. We now regularly get patients that come before a knee replacement's a common one to rehab their knee and get it ready for the replacement, and those patients always recover better afterwards. So if you came to physical therapy for a few weeks and it didn't resolve and you ended up needing surgery, there's no negative, effects of that. Like you're only preparing that shoulder to have surgery. So I think it's always a good idea to try some physical therapy, and then yeah, if you're opting for surgery, you're way more prepared.
Sounds good. Thanks, Todd.